Hello everyone, my name is Dr. Salman Afzal Sheikh. I am a registered medical practitioner. Currently, I am working as an emergency medical physician in one of the reputed tertiary care hospitals of my country. In the previous video, I gave a detailed introduction about myself, my professional qualifications, and what our program is all about. Before getting into today's video, I would request all of you to please visit our previous video so you get the basic idea about who I am and what our program is all about. Now, let's jump into our today's topic. Today, I'm going to tell you about high blood pressure. We are going to discuss that what is high blood pressure and what are its major clinical and non-clinical signs and symptoms. We will discuss that how does high blood pressure occurs, what are its causes, what are its major types, how our body get affected by high blood pressure, what are its major clinical and non-clinical signs and symptoms, and in the end I will tell you that why it is necessary for all of us to get ourselves checked regularly, because high blood pressure and hypertension is a serious clinical disorder. So, my friends, we all know that our body has blood, and the blood is required by every organ of the body for its proper functioning. Blood carries nutrients and oxygen to every organ of the body which is required for their basic functioning. Our body has an integrated system of blood vessels. These blood vessels carries blood to every organ of the body. Now, the blood requirement of every bodied organ depends upon its metabolic need. For example, our muscles has their own amount of blood requirement. Our brain has its own amount of blood requirement. When we exercise or when we use any particular organ of the body, the blood supply of that organ increases. Basically, the blood vessels in our body are soft and elastic. Whenever a blood supply to particular organ is increased or required, the vessels in that organs dilate and the blood is transported in more amount to that particular organ. As I mentioned before, I gave example before that when we exercise, our muscles require more blood. This happens in the same way. When we exercise, the blood vessels in our body in that particular muscle dilates and the blood flow to that particular organ increases and that organ work properly. So now, what is blood pressure? Blood pressure is that the particular volume of blood exerts a particular amount of pressure on a unit volume or a unit area of a vessel. So that pressure is termed as blood pressure. When that pressure falls down, it is termed as hypertension or low blood pressure. And when that pressure increases, it terms as hypertension or high blood pressure. How does high blood pressure affects our body? My friends, as I mentioned that whenever blood supply to organ is required, the vessels dilate and the blood is transported to there. When a constantly high level of blood pressure is being carried by a vessel, it affects the structure of the vessels. The muscle in that vessel wall become hard, the vessel become rod-like, the vessel loses the ability to dilate when it is required, and ultimately what happens that the blood supply to that particular organ decreases over a period of time, and ultimately a time comes when the organ shut down. So this is how blood high blood pressure typically affect any particular organ. Now, the question arises that what are the basic types of high blood pressure? My friends, there are two types of high blood pressure. The type 1 is primary or essential high blood pressure. The type 2 is secondary hypertension. First, we will look into what is secondary hypertension. Secondary hypertension is that we identify any particular cause in the body which is causing high blood pressure. For example, when the blood supply to the kidney decreases or the renal artery becomes narrows, it releases large amount of chemical in our body, and those chemicals ultimately constrict the vessels and creates hypertension. This is secondary hypertension, in which we have any particular source or particular cause of high blood pressure. The first type, which I mentioned before, is a primary or essential hypertension. It is the type of hypertension in which there is no particular cause being identified as a cause. There are numerous factors which the researchers over the period of time has discovered that these factors can lead to hypertension. I will discuss all these in detail in the end. We will discuss about the causes of hypertension. There are three basic stages of high blood pressure. Number one is stage one, number two is stage two, and number three is hypertensive emergency. Stage 1 hypertension is when the blood pressure rises from a particular level to a certain limit. For example, in stage 1, our systolic blood pressure reaches up to 130 and our diastolic blood pressure reaches up to 90. Now the question arises that what are systolic and diastolic blood pressure? My friends, the pressure of blood is measured in mercury unit, millimeter of mercury. When the heart contracts, the pressure in the blood vessel increases. That is termed as systolic blood pressure. Its normal value is 120 millimeter of mercury. And when the heart relaxes, the pressure in the vessel decreases, and that is termed as the diastolic blood pressure. Its value is 80. So the normal range of blood pressure is 120 by 80. And when for over a long period of time this range is disturbed and the pressure remain above this level, it is termed as hypertension. In stage 1, the level remains between 130 and 90 or 140 and 90. In stage 2, the level remain between 160 and 100. And in stage 3 or hypertensive emergency, the level reaches up to 180 and 120. Sorry. So now we come to the point that what is hypertension, how does blood pressure occurs, how does high blood pressure occurs, and what are its major types. Now we will discuss about that what are the causative factors of the high blood pressure. There are numerous causative factors which are being identified as a cause. Few of them include genetic factors and hereditary factors. Some people are more prone of developing high blood pressure. For example, the black African people or the people of the African origin, they are more prone to develop hypertension because of certain genetic changes in their body. Number two is hereditary factors. Hereditary factor include that if one of your parents has high blood pressure or is suffering from high blood pressure, then there is a high risk and high chance that you might also suffer from high blood pressure. The other factor include high salt intake. When we take large amount of salt in our diet, it ultimately leads to large amount of sodium in our body, and that sodium in our body constricts the blood vessels and it creates high blood pressure. The other factor include sedentary lifestyle. Sedentary lifestyle include eating too much junk food, eating too much fast foods, pizzas, burgers, shawarmas, and stuff like that. They cause a lot of hypertension. Drinking too much alcohol can lead to hypertension. One of the important and particular thing I would like to mention is cigarette smoking or tobacco consumption. Cigarette smoking and tobacco, both these constrict blood vessels. And when for a long period of time we take these things, our blood vessels become rod-like. Now you would imagine that how a constricted blood vessel can cause hypertension. I would give you an example. For example, you are watering your plant in your garden with a pipe. A normal level of water is coming out of pipe. When we press the opening of the pipe from one end, what will happen? The pressure from the other end increases and the water flow at higher rate. Same happen with the blood vessels. When the blood vessel constrict for a long period of time, the pressure in that blood vessel increases. So the nicotine and tobacco products do the same. The other factor includes poor sleep, poor mental health, chronic stress, chronic anxiety. They creates a lot of burden on our body. Our body produce a lot of catecholamines, stress hormones, cortisol, and they ultimately constrict the blood vessels and they generate a high volume of blood, and it ultimately leads to high blood pressure. Other factor includes lack of exercise. When we adopt a sedentary lifestyle, when we do not exercise, we lie down for a long period of time, watch movies, waking late at night, going to bed late at night, they put a lot of stress on our body. Our body does not remain good, and it ultimately leads to high blood pressure or hypertension. Now, I'm going to tell you the major clinical and non clinical signs and symptoms which can occur when a patient suffers from hypertension. Usually, hypertension is asymptomatic. Asymptomatic means that it does not produce any symptoms, but in some cases, it can produce symptoms, and the symptoms varies differently. For example, it can occur with the symptoms like headache, sometimes eye ache, vision loss, or poor vision at night or poor vision at daytime, ringing in the air, generalized lethargy, generalized weakness, chest pain, anxiety, mood swings, period problems, sexual health dysfunction, and foot ulcers, chronic leg pains, chronic visibility of veins on the leg. These are the few clinical things which can occur when a patient is suffering from hypertension. Now, as I mentioned in the beginning, that why it is important for all of us to get us checked regularly to know that whether we are suffering from hypertension or not. Because hypertension is a silent disease. As I mentioned, that it does not produce major clinical signs and symptoms at the early stages or in most of the cases. So, if there is a disease which is not producing any sign and symptoms, and it causing and it is damaging our body at a fast level, so it is very much necessary for all of us to get ourselves checked regularly so that we might know that whether we are suffering from hypertension or not. In the coming video, I will tell you in detail about what are the major impacts which can occur if we do not treat hypertension. So, if you want to watch that video, please stick to our program. Hopefully, it will benefit you people a lot in getting a knowledge. And if you are suffering, or if any family member of you is suffering from hypertension, this program will help you a lot in treating that disease. Thank you so much.